Well, hello. I'm Charles Beatty. I'm the chair of the Department of Otorhinolaryngology, Head and Neck Surgery here at Mayo in Rochester, Minnesota. And I want to share with you some exciting news for our department. We recently moved into a brand new facility here on Gonda 12. The Department of Otorhinolaryngology, or ear, nose, and throat, is a department that's been here at Mayo for many, many years. In fact, our first chair of the department was appointed in 1906, so over 100 years, and probably for the last 50 years or so, we've been located at West 5 in the Mayo Building. Our base of operations, services, and facilities were all primarily there, but over the course of the last 15, 20 years, we've outgrown that space, and we got to the point where we had to move some of our services to a hospital, Methodist Hospital, Eisenberg Building. Primarily these services had to do with balance testing, with checking hearing loss and programming patients with cochlear implants. And so often the patients with young children who had hearing loss had to go across the street or through the subway to go over and have their testing, come back and see their provider in West 5, or the elderly patient with balance issues and hearing loss, again, was navigating downtown, trying to get to a different building, come back to see their provider, get their hearing aids, have their balance rehabilitation and information provided. So very inefficient and unproductive for both staff and for patients. 3 years ago, in April of 2007, we started planning and designing this new floor. So why are we so excited? Well, I think we've gotten into the new space, and our patients and our faculty and our staff are uniformly enthused and inspired by this new space. So what's changed? What's different? Well, we went from a very cramped, shared, crowded lobby to a very spacious, inviting, open space for our patients. Now there's areas that are separated for children and families with children. We have educational opportunities in our lobby for patients as they're waiting to be seen by providers and evaluated. We have special work areas, workspace for nurses, staff, collaborators in care of patients. Now we can go to a separate space, look at their CT scans, look at their audiometric evaluations, balance studies, discuss this with perhaps other physicians and other providers before we go into the rooms. I think one of the unique features about our new exam rooms is most of them can be also procedural rooms where minor procedures can be done. The audiovisual equipment that is provided in each of the rooms is state-of-the-art, so that now patients as well as family members who have accompanied them can visualize the hole in the eardrum or the paralyzed vocal cord or perhaps the cancer in the throat that needs to be addressed. And we have monitors in each room on the left and the right of the patient so that the patient can also observe and see what we're seeing and why we're suggesting the kind of approach that's being recommended. Our testing booths for the pediatric and for the adult population for hearing loss is also state-of-the-art, and many instruments and audiovisual equipment there as well to facilitate better testing and keep the children interactive with their testing personnel. Much more comfortable, much more accessible for our patients as well. So we've consolidated our staff and our activities onto one floor. We've integrated the staff and able now to have many more interactions. What a great opportunity for our staff, and I mean all staff. The planning and design that went into the facility, everyone had input. This is from our nurses, our secretaries, our clinical assistants, physician, resident staff. Everyone has offered up ideas, and it's just been extremely inspiring and invigorating to see what's come off of that paper, and now we're finally into it. So I think our only hope is that we can continue to operate and provide the care and grow in this space, similar to what we had on West 5 for many, many years, many decades. but we're excited and enthused. It's a new era for our department, so we look forward to serving our patients and the inspiration that's provided our staff.